Hello and welcome to the session of Talking Tech, Women and Girls in ICTs. My name is Ayda Dabiri from the International Telecommunication Union, and I have the pleasure today to be having a discussion with Aerts, head of the Novartis Foundation. Talking Tech is a series celebrating girls and women in tech that is recorded around the world in celebration of Girls in ICT Day. This is an international day celebrated around the world on the fourth Thursday of each April, with the objective to help create a global environment that empowers girls and young women to consider a future in ICTs. The Talking Tech series is brought to you by ITU, the UNICC, and the Office of the UN Secretary General's Special Envoy on Youth, and it is in support of Equals, the global partnership for gender equality in the digital age. I am delighted to be speaking with Anne today. She is an inspiring figure in the life sciences industry, and she is passionate about using data science and technology to improve health outcomes around the world. She is a trained medical doctor, and she also chairs the Broadband Commission for Sustainable Development's Working Group on Digital Health. Prior to the Novartis Foundation, Anne was director of the Belgian Lung and Tuberculosis Association, and she was the head of the Health Services Department at the International Committee of the Red Cross, the ICRC. Anne has had a very interesting career, and I'm excited to introduce her to you now. Hello, Anne.
Hi, Ayda. What
How
a
are
pleasure
you?
to be here.
Thank you very much for joining us. I know we've gone digital now for over a year, so I am excited to have this conversation with you on Zoom. So,
Very nice.
and maybe I'll start with the first question and just explain to everyone again that you began your career studying medicine. You studied also tropical medicine and public health. Could you tell us more about your career path and how you combined both the life sciences and technology?
Yeah, thanks, Ayda. So indeed, I studied medicine, and the reason why I studied was either for science or for humanity, I would say, for the people around the world. So what I did was when I finished my studies, I worked for a few years as an emergency physician in my own country, in Belgium, and then I left abroad to many different countries. In fact, I worked in several countries in Africa, in Asia, in ex-USSR also, and mainly in areas where there was conflict, as I was an emergency physician. And at that time, I was a very big idealist, of course. But after that work, I really wanted to have a normal life because I wanted to have children, and so I went back to my home country and worked a while for the government. In fact, we set up the emergency response there in Belgium when it was the September 11, when we had these bioterrorism attacks at the time. It's a long time ago, but it was kind of very impressive. And then I joined Novartis after I was working in the Tuberculosis Association as well. I joined Novartis because it's my second passion to work for research and development. So in the first 7 years at the company Novartis, I was working in research specifically for cardiovascular medicine. And then when I had the chance, I joined the Novartis Foundation because in fact it combines nicely my two passions, both the work abroad for in tropical medicine first, but now it's much more in global health in all of the different countries you can imagine, and the passion about how we can apply science to improve the health of populations around the world. So this kind of career is not so usual in the business. In fact, I came into the business very late. It was only a second part of my career, if you may. But I like it because it gives you a very broad perspective of different sectors and how different sectors function. So the non-profit sector, the government sector, and now the private sector.
Thank you. I think your career story is probably what a lot of us aspire to, is combining passions and interests and being able to have different vantage points, which I'll ask you about later as well. But maybe before we proceed, can you tell us more about your work at the Novartis Foundation and what you do there?
Yeah, the foundation. So we really focus on how we can advance data and digital driven approaches towards improving population health. And what we exactly do first, the first years, we were really focusing on how we can eliminate diseases such as malaria and leprosy. around the world, and we were pretty successful in that. But now, since about 5, 6 years, we have shifted gears towards addressing the world's main problem, in fact, cardiovascular disease, which is the leading cause of death. And we want to innovate the way we address that by working with local governments and their partners, whomever they can be, working together and innovating the thinking and also the delivery of health and care services so that um, people can be much earlier detected when they have a problem of cardiovascular disease. And in fact, it starts at young age very often with high blood pressure or with diabetes, for example. But people can walk around with these problems that are the drivers behind cardiovascular disease for many, many years without any symptoms. So that is where at the foundation we have been underpinning all of our work with the digital technology, as we are very strong, passionate believers that the digital transforms the way you can deliver health and care. So to identify people earlier, for example, we would work in Ho Chi Minh City in Vietnam with shopkeepers in any kinds of shops like manicure salons or barber salons or even in the markets, the supermarkets. And we train the shopkeepers to measure blood pressure with an automated Bluetooth measurement system that would refer the people screening positive automatically by the digital solution to the health system so that when they were suspect for having high blood pressure, they would at least be followed up in the health system. And that was possible thanks to the digital system, but also it showed the government that it's very, very possible and feasible to work with non-skilled health, non-traditional health players, if you may, people who have no skills whatsoever in medical care, to train them in delivering the right testing and the right messaging to the people. So they were also trained in informing persons who were screening normal. You do well, keep on going like that. And what is healthy for you is this and that and that. But people who would screen with too high blood pressure, they would really stress that it's important they present themselves in the health system. And some things like that, and this sounds very simple, but in fact, it was a big mindset shift in the governments also for them to understand, yes, some of the things we currently do, and that is overburdening our hospitals, where people are waiting in the corridors for a whole day to get their blood pressure measured, and that is really not necessary. We can now do that outside of the walls of our health system. And in fact, this became national policy now in Vietnam, so they scaled it through the other cities as well.
That's
It works, yeah.
that's
It's an
fantastic.
example, it's a
Yeah,
pure example. But this is in fact how we look at things in the foundation for every issue we face on the ground. So we try to look with the local authorities, what are your main priorities you want to really address, and then we define the solutions together. It's not that we come with a ready-made solution and say, let's roll out this fancy new app for your patients with this and that and that. We don't. We look at what are their main issues, and if they identify issues that we feel, according to the data available, are not the priority, we also challenge them. And then we come up with the proper definition of what we want to solve. And as you know, with tech, the solution is often easier to find than defining properly the problem. But the solution on itself is rarely the solution only. You need to have it as an enabling factor for driving the whole problem solving.
that's an excellent point, and I think one thing your career kind of exemplifies is that you've had experience in so many different facets in research and on the ground as a medical doctor, um, uh, in the ICRC in Belgium. Can you maybe give some pieces of advice for women and girls out there who want to use technology as a solution, but to actually do this, you have to interface with so many different disciplines and types of industry.
Oh, absolutely. I think my main advice would be go for it, because I am a true believer that women in tech are better. They are better designers, and for the simple reason that we are more open to really listen and define properly the problem, or listen and involve the people who will have to use the solution in the solution creation. If you do that, you can be sure that the solution will be much more successful in getting to scale than if you come with a solution where you didn't talk to the end users in the end, who will have to integrate them in their workflow or in their new way of working. If you involve the people and you listen to what they want to really change in the way they currently have to do their jobs or other things, then you are more successful. And I feel women in tech can be much stronger in that than men. And I recently read women are better designers also. So I believe in that. Go for it. And if I may, an advice, yeah, do whatever, take whatever opportunity comes on your way. And it's not specifically for women or girls, that advice, but it's like that I consider life as well. In fact, I didn't choose this pathway where I am now, but in the end, you realize that you had to pass all these different steps, and this multi-sector experience serves me really well now to bring together the health and the tech part as well, to understand that tech, uh, private sector players, for example, our colleagues from Microsoft, they talk very differently. But in the business language, they talk the same language. So we find the touch points, but still we have to bundle the expertises from different sectors. You can never address everything alone. The problems we currently face, and specifically in the health sector, are far too big for one player alone. So it is by definition a multi-sector approach we have to take, and then not only in different disciplines between health and science or technology, but also in different sectors. The public and the private sector have very different needs and perspectives, and they can absolutely learn massively important things from each other. So I would encourage everyone, if you have a chance to work for a while for one sector and then change sectors, that's really enriching. And never say no to an opportunity that seems interesting for you. Sometimes it's scary, yeah, to really say, will I really give this up? I had that at several times when for example, when I was leading the health services in the ICRC, I decided myself it was time to stop, because I feel there's a time for everything also, and you feel it. When you want to change something, you have time to stop. But then my next role was leading the Belgian Association for Lung Health. And it was a really interesting role. And I said, am I really going to step away from that to go into the private sector, where I had this opportunity to join Novartis by chance? In fact, it came to me. And I just went for it. It's a bit crazy. It's really crazy if you come from the public sector and the nonprofit sector to make that big step. It was a whole learning for me, but I'm so happy I did it. Look at the opportunities that came with that now, and with all the fantastic work we are able to do in the foundation. So I am very happy about my career, and I would say really don't hesitate. It's hard, it's scary, but go for it.
That's fantastic. Thank you. I have so many follow-up questions, but maybe to begin, can you give not begin, but can you give a few thoughts on technology and how you've seen that change? So you've been at Novartis Foundation since 2013, I believe, and
Yeah.
technology moves fast.
Oh, yeah.
Can you?
So in the beginning, we were really working with the things that are very mature models now, the telemedicine type of
Mm,
things. Now we are working on AI-driven diagnosis to accelerate COVID diagnosis, for example, in São Paulo. So it's a really massive shift, and it goes very fast. But if I may go one step back, when I was this young physician in Africa, for example, in one of the countries I was working in the guerrilla area where there was a war, and I was dropped by plane to go to the different settlements or villages where people were keeping the wounded for me to pass there, but I often came too late with my bicycle. They dropped me by plane by bicycle from village to village, in crossing the river with my bike on my shoulder sometimes. So I came too late very often, and that simply was the way we could work. if I think about that now, and that's a long time ago, obviously, we could handle that by phone, by simple phone or WhatsApp now. You can guide non-skilled village or community workers to help those patients stop their bleeding, or all the emergency facets. You can help them. And telemedicine has really proven that. Our model we built similarly in Ghana between community health workers and then the reference hospital center where doctors and midwives were available 24/7 to answer the calls. You can guide non-skilled workers through their patient care and save a lot of people. We knew that 70%, 70% of all the problems can be solved by phone. And 30% of all the referrals they would normally have done from faraway areas to the hospital, which would have been very risky, 30% of those could have been avoided. So telemedicine per se is really a revolution already, and it takes up to COVID now to get it more or less as the new normal, because even the most skeptical health professionals like me have been taken over the line now that virtual care is massively beneficial, specifically in a situation like COVID. So let's hope that blooms now. I hope it gets reimbursed and rolled out everywhere. But what you can do now with technology is so impressive. I mean, with simple tools that are developed, for example, in China, in the beginning of the epidemic, they developed diagnostics with lung imaging, with AI-driven diagnostic to diagnose COVID. That type of solution was rapidly adapted with the local data in Sao Paulo, where we are running a major urban population health initiative there, with the data lake of the university hospital, and built into the Brazilian COVID diagnostic system with lung images. And that could save tens and tens of thousands of people to have to wait for their diagnosis. Or I can give you another example. We started working on the elimination of leprosy, the oldest disease known to man since 40 years. And we've reduced leprosy by 99%. In fact, everybody thinks it's gone, but there's still like 100, 150,000, 200,000 new patients every year. And that's too many. Yeah? But these last 200,000, we couldn't get them down simply because the last miles of eliminating a disease are always the most difficult. So we established a strategy a few years ago that really looked at how we can do that, and definitely did it with much more stringent contact tracing and follow-up. But then we said, let's use digital. The newest technology available nowadays is now going to eliminate the oldest disease we know, which has never had a diagnostic. 3,000 years we know about leprosy. It's never been able to develop. We are never been able to develop a diagnostic tool to really pinpoint who has that disease or who hasn't. Now we use skin images, so with a mobile phone, whatever kind of quality, you can send it to the cloud and you get a probability back of what is the chance that this is leprosy, thanks to the work we did in partnership with Microsoft on AI for leprosy. And this kind of revolution, you cannot imagine how important it is. 3,000 years and we can solve this now. It's really fantastic, isn't it?
That's incredible. I think you mentioned things that seem mature to us now, like telemedicine, and things that seem kind of obvious. They're fairly new, and it takes probably a
Yes.
lot of partnership to make that happen. And
Yeah.
can you maybe go into some challenges you faced either in your particular role now at Novartis Foundation or just generally in your career? And how would you recommend people kind of facing those challenges?
Yeah, there are challenges every day, eh? But specifically in my career, I think you what I find difficult is that I am not a tech person, but I am passionate about what it can do, and sometimes I have difficulties follow and to understand what we could imagine. But then what helps me is that I really have a feeling that I'm very well grounded in the reality of the majority of the world, which is low and middle income settings, where I have lived and worked for many years, so I understand the situation there is really radically different. And they have most to gain from this revolution of digital technology, specifically in health, and AI even more. But they also have most to lose. So there's a lot of challenges in that field. For example, when you want to introduce an AI driven solution that has worked in one context and you want to tailor it to another one, in Senegal, for example, we have to build the data from scratch because data systems in the health sector are still paper based the day of today, even though it would be feasible to do that on a mobile phone and make it so simple. But that requires a lot of investments and a lot of partnerships, as you say, that are not easily aligned always. So I think the main challenges are to really pinpoint which are the strategically fit partners to solve a certain problem, and then align those partners behind that and find the solutions to do so. And if it's necessary, build the data and go slower. But yeah, the speed of how we would work here in Europe or somewhere in high income settings is sometimes not possible in low and middle income settings, but sometimes it's the opposite. So it's challenging and also a lot of opportunities. Where cities or settings where there is no electronic health record whatsoever is sometimes better because you can start from with a clean, well-designed architecture of your data and build a much nicer solution. So sometimes it's faster, sometimes it makes you slow down a lot.
That's very interesting. And one thing I'm getting out of all these things you're saying too is that many people probably have a passion for technology, but maybe they either don't like to code or they don't want to code. But there's room, kind of, I think, for everyone, especially women and girls, to make an impact here. So I think that that's very inspiring, especially for myself. Um, Maybe you could give us a few words on things outside of career, maybe that you do to maybe keep you grounded or that you're interested in, that, or maybe some pieces of advice that kind of are outside the career realm for the women and girls watching.
Yeah, well, I have to become old like I am now to realize one thing in life, and that was I have a very strong sense of purpose. What I wanted to do was really what I did, having a real or trying to make an impact on the health for many people in the world, and that was my purpose. I realized you can as well do that at home and close to your home and have your purpose in many other aspects of your life as well. So I have been a workaholic, I have to say. I have worked like hell my whole career, a lot, but I now realize there's a lot more to work to life than work only. Of course, I have a family. I have two children, fantastic children, and they educated themselves because I'm not so much there for them, but they are really fabulous ladies as well. And I hope one of them will go in the tech sector, but we'll see. And I think you have to have a lot of other interests as well to be able to bring together new ideas and really innovate in the path you have chosen to innovate. You have to bring as many ideas as possible to the table. So I'm very interested in art, but also in sports. I cannot live without doing sports. It's necessary to be able to do a very busy job. You need to have a lot of physical exercise as well to get your rest back, but also training in a lot of these techniques of mindfulness is very important for me, as you get happiness from there. I feel you feel rested, you feel calm much more when you do apply them than when you don't. So I have kind of different interests, and also in several traditional medicines aspects I'm interested. But yeah, I think you need to have different perspectives in life.
That's great advice. I think we can all relate to that wherever you are in your career. It's nice to have some balance, but also a purpose behind everything, if possible. Now,
Yeah.
you've talked a lot about what you've done in your career and the things that you have seen. Can you maybe say a few words about the future, like what you think maybe are the challenges? Where can the women and girls and the boys too who are watching, where do we need people, and what are your hopes, I guess?
Where we need people, oh, I think in data science and digital technology, there's a huge lack of skilled people in all of the world, both high and low income settings. So one of the Broadband Commission report AI in health recommendations is, in fact, we have this roadmap for countries to invest in 6 areas if they want to advance on the readiness to deploy AI in their health system. And one of these areas is in the skills of the people in their workforces. So I think that the skills that are really missing is definitely data science and digital technology. So I would highly recommend everyone who's interested in that to pursue that path because that's the way forward. All of our lives are changing thanks to the power of AI. And specifically, the health sector is maybe even a little behind in the AI revolution. So, there, if you're interested in health and AI, is even more interesting. So, that's definitely a future in the health sector. I believe the power has to be in the hands of the people themselves, not in the hands of the medical sector anymore. So, people who have a disease or a health issue, whether it's a short or a long term issue, they have to have much more power in their own hands and manage their own health. That's the only way you will get to really good results. You know how bad we are in the health profession in controlling diseases such as high blood pressure, for example. Only half of the people get their blood pressure controlled because they stop taking their medicines when they feel they have no symptoms. So, what's the reason why I should take a therapy? So, people, if they know their own numbers and they know they have to follow them up, if they stop or forget to take their medicine, they will get higher numbers. And that's not what they want because it's a risky thing. So if people really have that good information and the tools in their hands, I feel the virtual tools will be super coaches for them to continue taking their medicine and adhering to it in a lifelong fashion, which is what they will need. So bringing the health and the care to where people live in their living room or where they work in their workplace, if it's not possible at home, or even in the schools, is going to be really instrumental to equalize the level of access to health and care around the world.
Those are some great points, I think, especially as technology is reaching so many people, that also
Yeah.
empowering them in regards to their health
Yes.
and there's the mental aspect as well and the psychology behind it. So I think you've shown again just how multidisciplinary the health sector is and
Yeah.
tech, and there's so many people and viewpoints that need to be involved. I'm mindful of your time. You must be extremely busy, so I won't keep you for too much
Oh,
longer.
yeah. Thanks, Aida. But I wanted to know from you, what about you? How did you get in tech? Tell me.
Thank you. So I work at ITU on the AI for Good Global Summit that ITU has, as well as the ITU and WHO focus group on
Ah,
AI for health.
fantastic. Yeah.
And so I know about Novartis's work and your work, and so I'm really excited to speak with you today. And I am kind of tangentially in tech as well, but I grew up with a mom who was is a programmer, and she was always reading,
Really? Oh,
always
nice.
learning. She just loved it. Like it was truly a hobby, and he would learn programming languages and just say, "Oh, it's just like learning, a language. Everything just makes sense." Um,
Really?
so I aspire to be more like her and get more into tech, but I was always kind of exposed to that. But I had a leaning towards the business side as well. So I studied business, but I ended up was excited to come to ITU and see the standardization part and technology. So I have a passion for health as well. So again, very excited to talk with
This
you.
is this is so nice. And your work you do with the AI for Good Summit is really instrumental. I think you get every year many more attendants and participants, but they are really great discussions. And now you modified it to an online version, which is even more attended, I can imagine. And what do you like most about tech?
Tech, yeah. I think just the possibility and the innovation. Um, I think more and more what I'm liking about this industry is this growing realization, and it's what you do of the multidisciplinary aspect. So, one thing I really like about my job at the summit and with the focus group is we get to work with medical doctors. You know, like
Yeah,
yourself, we get to work with engineers, with telecom providers, with,
yeah,
like even the psychiatrists we have, and the social sciences. So I think, yeah, what I like most about tech is just this melding of the different worlds, because I think
yeah.
we're seeing that we need kind of everyone to be on the same page and work together,
Hmm.
and that, like, I always kind of think a programmer is not God, like he or she doesn't necessarily know the topical problem, so we all need to kind of
It's
work
true.
together.
Yeah, that's
As you mentioned,
also what I felt. Yeah,
as
so
you mentioned,
nice.
yeah.
So nice how you formulate that, melting the different worlds. I like that.
Thank you.
And is there anything specific you're very proud about?
I think I'm proud of the work at ITU. I think, especially with the AI Summit, it's kind of a unique event, a unique initiative, because we also have lots of UN agencies as well, and
Yeah,
governments. Traditionally, IT works with
yeah,
a lot of governments, so I'm proud of the work we do, because I think it's breaking down some walls, and it's part of a bigger effort. It's obviously not just the summit. So I'm proud of that. I'm proud of the people I work with, and how we were able to adapt to COVID, because COVID was really tough for a lot of people. But I hope that we can continue discussion and innovating.
yeah.
So
You should. Congratulations with that, with your work, because it is truly very inspiring and very important for many different sectors, as you said. And what are your plans moving forward?
so yeah, that's a great question. I liked what you said about. I think you said, having an open mind. I For my future, I'd really like to stay in the health field. I
Yeah,
find it hugely interesting from just a kind of intellectual point of view, even just to know what's going on with our bodies. I think health is such a blessing, I guess, and I think we take it for granted, and I think we maybe take for granted all the developments in medicine, and it's very exciting stuff. So I started taking some science
yeah.
courses online during this pandemic, because everything's online. So um, yeah, I'd
Oh,
like to carve
great.
a future in there somehow.
Nice.
We'll see.
Okay, nice to know.
Yeah, thank you.
And I wish you all the best of success then. Thanks
Thank
so
you.
much.
And thank you so much, Anne, again, for taking the time out of your extremely busy schedule. I'm sure
Oh,
this.
thanks to you. Come on. It was a real pleasure to speak to you. Thank you so much for the invitation.
Thank
Thanks
you
so
again,
much, Ed.
Anne.
Have a good day, Ed.
You
Ciao, Aida.
too. Bye.